From today onwards, we'll be starting the videos regarding the MBBS whole 19 subjects, starting with the PEDS. In case of PEDS, first we'll be going with what is known as neonatology. And the following topics are already done, so just I'm going to tell a brief headings regarding all of them. First is some basic definitions. And that will be already done with neonate together with whole of neonate classification, and later on we'll be going for with what is known as period of gestation, how it is calculated. It is calculated either with the help of LMP or with the help of ultrasound on the best in case of pediatrics is of Ballard score. Now next topic is physiology of meconium as well as urine. See how all the Potter sequence happens and what is the disadvantages or advantages of polyhydramnios. And next we'll be going with what is known as IUGR and how it is different from SDA and what differences between IUGR versus SDA and what are the complications associated with. Once that was done with, we have already done the neonatal whole of the screening, and in that we have already done with congenital hypothyroidism, acquired hypothyroidism, maple syrup urine disease, as well as phenylketonuria. Next we have usually going with normal neonatal phenomena. In this we have usually discussed a list of topics. Once that was done with, we'll be going for what is known as congenital structural abnormalities. We have usually done with congenital diaphragmatic hernias, tracheoesophageal fistulas, esophageal atresia, neural tube defects. And once that was done with, we have usually gone with neonatal resuscitation and Apgar score. And after that we have already started with the prematurity complications. First we have usually done with respiratory complications, in which we have in brief discussed regarding the hyaline membrane disease as well as respiratory distress syndrome. And next is bronchopulmonary dysplasia. Whole this covers the respiratory complications. Once that was done with, will be started already with CNS complications of prematurity, which includes first stage of apnea, how the apnea usually happens and how it is different from periodic breathing. And in case of apnea, we have discussed two important topics. First is bilateral choanal attrition and apnea prematurity. And next we have usually done with intraventricular hemorrhage also. Next we have usually gone with neonatal seizures as well as that of the birth asphyxia. Once that was done with, in case of serious complications, PDA, that is patent ductus arteriosus, is actually that of most important complication in case of neonate. But we discuss it in the later in the systems, and here we also discuss it regarding the fetal circulation, which actually simply starts from placenta to umbilical vein to next usually starts the ductus venosus, which directly connects the inferior vena cava, or here there is portal vein, hepatic veins and liver as well as hepatic veins, and which in turn drains into IVC. IVC gradually opens into right atrium, and from right atrium it goes into right ventricle, but this right atrium usually has foramen, patent foramen of oval, through which it goes into left atrium and left ventricle. From there it usually goes into the aorta, but this aorta has a connection with the pulmonary artery or the pulmonary trunk through the ductus arteriosus. So from here it usually supplies the whole of the body, and finally it usually comes into the umbilical arteries, from where it usually starts the from where actually starts the umbilical vein and finally drains into the placenta. So in case of fetus, most oxygenated blood lies in umbilical vein, which is 1, that is 1 in number, that is single. And in case of fetus, the deoxygenated blood lies in umbilical artery, which is of 2 in number. And now we'll be starting with GI complications of prematurity.